So August 18th, we had gotten a phone call from daycare, and they had told us that they were worried about how she was breathing.
I was not thinking it was anywhere near as serious as it ended up being.
I knew it was serious because we're getting transferred over in an ambulance, but at this point, he's not saying a word to me. They're just working on her. I can't see what's going on. About halfway through the ride, he stopped talking to me and asked the driver how far out we were and to hit the lights and go. You know, that's one of the scariest things you could ever see as a father. And by the time we got to the hospital, we walk into the ER and the staff just descends on her and starts taking care of her. I was in the room for a little bit and I just could not stay there any longer. I mean, there's no way you want to see that happening to your daughter.
When she came in, she came in with a respiratory virus that was so severe it put her into respiratory failure. And that's how we found out that she had the heart problem.
So once we made the diagnosis that she actually had a heart condition and not a respiratory or lung condition, then it became a decision about, okay, how do we deal with it and when do we deal with it?
On top of the mitral valve stenosis, that was the underlying cause. Basically, as soon as she got sick, combined with this heart condition, it just so she went from being okay to basically falling off a cliff. Yeah.
Her problem is that valve, called the mitral valve, sitting on the left side between the upper and lower chamber, the blood is having trouble getting from the upper to lower chamber because the valve is so tight and so narrow, so malformed. You're going to require surgery.
Dr. T.Y. was brought in, and I have to say, from the moment we met him, there was we felt calmer and at peace.
You know, the first valve you put in only going to last about a year to 2 years. Another open heart surgery to replace that. So we may be, at 2 years of age? Until she grows to a full-size adult, you're looking at repeated open heart surgery, and the risk of each operation goes up. In the best case scenario, save her valve. That's what we wanted to do.
We have multiple doctors and nurses who we spoke to all separately, and we were like, we're at Yale, New Haven Children's Hospital. What do you think? Do you think we should get a second opinion? And they all said no. Yeah. You're in the right place.
And then we proceeded with the surgery. We closed the heart back together, get it working again, get her off the bypass machine that we used to do the surgery, so the heart is working on its own now, and the lungs are working as well. The potential impact you deliver to a child with a heart condition is such that you give that baby a lifetime of possibilities.
It's wonderful to sort of see her sort of become into her own after, her heart was repaired and she's really able to do everything she really wanted to do.
She's got so much energy, she's got so much life, and it's just a blessing just to have her here with us all the time.
So Shay is now home, she's thriving, she's, really a great, amazing kid. When you look at her, you wouldn't even know that she had heart surgery and sort of everything that she went through.
She's a totally different baby than prior to the whole illness. She is the comeback kid for sure.